Guys, and welcome back to my YouTube channel. So in this video we will be discussing about the clinical anatomy of the thyroid gland. Okay, so what are the subheadings under this topic are: first of all, goiter, then effect of massive enlargement of thyroid gland, then we'll be doing the retrosternal goiter. It is a type of goiter only, and the benign tumor. Also we'll be looking about the smaller other points such as why does it move during deglutition, and what are the 3Ds of the characteristic pressure symptoms. Okay, so let's get started. So what is goiter? Goiter is an enlargement of the thyroid gland, except that during menstruation and lactation. Okay, so goiter is an enlargement. You need to remember that in menstruation and lactation also the goiter, like the thyroid gland, is enlarged, but except these cases it is known as goiter. It may be associated with hyperfunction or hyperfunction of the gland. Okay, hypofunction or hyperfunction of the gland. Hypothyroidism occurs when there is insufficient secretion of T3 and T4. Okay, as the name suggests, hypo. Okay, hypo means less, insufficient secretion, and decreased level of T3 and T4 caused increased secretion of your thyroid stimulating hormone or TSH. Okay, so now what is given else that hypothyroidism causes cretinism in children and myxoedema in adults. Okay, this is also given in your physiology book. Okay, in the physiology textbooks, I read Visham Venkatesh book for physiology. Now, hyperthyroidism or thyrotoxicosis occurs due to excess secretion of T3 and T4, and it leads to presents as clinically presented as tachycardia, tremors, systolic bruit, and the main effects are due to increased your basal metabolic rate. Okay, what is systolic bruit? It is systolic murmur. Murmur is an type of abnormal heart sound. Okay, simple goiter, also known as puberty goiter, enlargement of the thyroid gland without signs of hyperthyroidism. It occurs due to deficiency of iodine in diet. Easy. Remember, iodine is essential for synthesis of thyroid hormone, but if it is deficient, then it leads to simple goiter. Okay, now simple goiter commonly occurs in females at the age of puberty, hence it is also known as your puberty goiter. Okay, now moving towards the effect of massive enlargement of goiter. See, the thyroid gland can enlarge, okay, backwards and downwards, but it cannot enlarge upwards due to its attachments to the its attachment to the facial sheath. Okay, upwards its attachment to the facial sheath and the sternothyroid muscle. Okay, so now it hence the enlargement gland buries itself around the sides of the trachea because, and as hence the 3Ds are caused. What are these 3Ds which is due to the enlargement of thyroid gland? They are dyspnea, dysphagia, and dysphonia. Dyspnea, difficulty in breathing; dysphagia, difficulty in swallowing; and dysphonia, hoarseness of voice. Okay, how to remember that the trick is 3D. Okay, moving towards retrosternal goiter. What is retrosternal goiter? The downward expansion, retrosternum, behind the sternum. Okay, downward expansion behind the sternum is known as retrosternal goiter. It can compress trachea, leading to dangerous dyspnea. Now, just as we read, what is dyspnea? It is the difficulty in breathing due to pressure on trachea. Okay, now what is total thyroidectomy and thyroidectomy? So thyroidectomy is removal of thyroid gland with its true capsule. Okay, this is also clinically correlated to the other thing which we had read as a prostate gland. Okay, this capsule thing. So thyroidectomy is removal of thyroid gland with its true capsule. Okay, now it is surgical removal performed to remove the part or whole of the thyroid gland. It is performed in condition of when is this performed? This is performed in condition of malign conditions, benign conditions of tumor. Okay, thyroid nodules, obstructive or substernal goiter. Okay, moving towards the ligation of thyroid arteries during thyroidectomy. The superior thyroid artery and the external laryngeal nerve diverge from each other near the apex of the thyroid gland. Hence, they are therefore during thyroidectomy, the superior thyroid artery and should be ligated as close as possible to the apex. As possible to avoid injury to the external laryngeal nerve. Easy. Now, what are benign tumors? It will compress due to displacement of the neighboring structures, whereas malignant growth tends to invade surrounding structures. Okay, now how do we treat goiter? Last topic is treatment of goiter. It is like radioactive iodine therapy, also known as radioiodine therapy. What is it? It is used in cases of when the thyroid gland is overactive, and it involves the intake of radioactive iodine orally. Okay, what is it? Radioiodine therapy. Thank you. Please give your valuable feedbacks in the comment section. If you are not willing to subscribe at this point of time to my YouTube channel, it's all right, but please let me know your valuable feedbacks in my comment section. Thank you.